Hi, Dr. David here. I want to say a few things about why Black women tend to have it worse off, or why they are worse off than white women and other races are when it comes to breast cancer. I'm going to throw a few things out there, so pay attention. Like I said before, if you're over the age of 50 and you have breast cancer, you're twice as likely to die from breast cancer as a white woman is. About 40% more likely if you're below the age of 50. So it's very, very important you really understand what it takes. Now, some of the risk factors are obesity, very dense breasts. Black women tend to have denser breasts than white women do. Even if they're the same weight, their breasts are the same size, their breasts tend to be a lot denser. So dense breast tissue is one of the risk factors. If you didn't breastfeed your children effectively or long enough, if you're giving them Coca-Cola instead of breast milk, that is a problem. It can raise your risk of breast cancer. So you need to be taking the precautionary measures. Another thing that they're seeing is hair products. Yes, those things that make you look so beautiful and make your hair look great. Amongst them are the parabens and the phthalates, and I think I've got the other one that they have it. I mean, anyway, you know that a lot of these chemicals are in a lot of these hair products, and a lot of chemicals, are in hair products. And what they are seeing is that it tends to affect Black people worse off. Here we go again. Than white people do, and stimulates inflammation and can put you at a higher risk for breast cancer. Activity levels are also a problem. White people, again, tend to go to the gym more. They tend to work out more. They tend to work out outside more than Black people do. That's just a fact. So you want to be more active. You want to be more mobile, especially if you have breast cancer. You want to be out in the sun, and you want to be out be more active in exercising and doing those activities that are for outside. So that is super, super important. What else can we talk about with regards to breast cancer? Vitamin D levels. If you're Black, your vitamin D levels are most likely low. So you want to increase that. We also know that magnesium levels are low. We also know that potassium levels are lower in Black women than white people. So you've got to start taking supplements. You've got to start taking supplements. Vitamin D, vitamin C, and K are the top ones I would strongly recommend. Then on top of that, you want to take things like ACE Mannan, things that specifically boost the activities of the macrophages, the immune cells. I would call them the captains of the immune system, the Captain Americas of the immune system. They are the ones who surveil, who go around the body, and they look for problems, bad cells, rogue cells, bacteria, viruses, harmful toxins, and they are harmful bacteria, harmful viruses. Toxins are harmful by definition. Anyway, so they go after those problems and they eat them up. If your macrophages are well empowered with ACE Mannan, they will be more likely to locate those problems, nip them in the bud, and get them out of the way. And so it's very important. But even after you get cancer, it's also important that you take these supplements even more. So I'll be talking with Vicky Latham about toxins and about zeolites. Zeolites are like minerals that help to mop up toxins from the body. We know that people who are more toxic tend to have higher risk of having things like breast cancer. So we're talking about some of the solutions to toxicity and things that you can do while you're receiving treatment. You always should be taking treatment from your oncologist for breast cancer. Don't get it twisted. Most people don't really make it. Well, my experience in radiation oncology is that those who use everything, not just the chemotherapy, not just radiotherapy, not just surgery, but also address it from the nutritional side. Also, they address their diets, they address their activity levels, they address their mindsets, they also address their beliefs and their relationship with other people. When you do it from this whole 360 view, this 360 approach from all the angles, when you strengthen all these areas, you have a much, much, much better chance of recovering and living 10, 15, 20, 25, 30 years after your diagnosis of breast cancer. So stay tuned. We're going to have lots of information coming out to you. Make sure you like our videos, just subscribe to our channels. You know how that works, right? Okay, well, thank you so much for joining. We'll talk to you later. God bless. Bye.